Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting today on County TV Channel 20 and the county's YouTube channel. This meeting is also being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting the press conference in Spanish, and his interpretation will be available on the county's website and the YouTube page shortly after we conclude. There were a lot of people outside this past weekend. Fortunately, it was warm but not unbearably hot on Saturday and Sunday. The Sheriff's Department had officers patrolling the sand at the beaches from Gaviota to Rincon and at local trailheads. Deputies were making contact and talking with people at the beach about how important it is to practice physical distancing even while outdoors. County lifeguards were also at the entrance to Arroyo Burro Beach, controlling access to the beach and educating everyone who drove into the parking lot about social distancing guidelines. The overflow parking lot at Arroyo Burro was also closed, and there was a big sign advising beachgoers to avoid overcrowding because too many people could force the closure of beaches. Half of the parking lots at Goleta Beach Park were also closed to limit crowds. Park rangers were educating beachgoers about physical distancing at county parks. The UCSB Police Department was patrolling beaches in Isla Vista. The city of Goleta proactively reduced parking at the Elwood Open Space, and law enforcement were patrolling parks and beach access points in Goleta. The city of Santa Barbara had police officers, fire personnel and trucks, harbor patrol, park rangers, park maintenance crews, and red shirt ambassadors providing a visible presence along the waterfront. The city also had 4 electronic messaging boards along Cabrillo Boulevard advising about social distancing requirements. The city of Carpinteria reduced parking on Linden Avenue to reduce crowds at Carpinteria beaches, and the Carpinteria State Beach parking lot was closed. Many parking citations were issued to people who parked illegally in neighborhoods adjacent to the beaches. There was a lot of collaborative work done by all local agencies across the South Coast to anticipate and control crowds at local beaches. There will be even more enforcement this upcoming weekend. Everyone needs to continue to try to stay healthy while we are under the governor's stay-at-home order. Exercise and fresh air are very important to maintaining good physical and mental health. At the same time, we each have a responsibility to do our own part to support managing the dual challenge of recreating safely while also protecting public health. I'll say it once again, if you go to a park or a beach or a trailhead and there are already too many people there, go somewhere else. Even though we are trying to stay physically apart from each other, we must not allow that physical distance to stop us from connecting with friends and loved ones emotionally. We are not alone in this crisis. We're more connected than ever because we are all going through this together. But it can feel lonely, and if you are feeling alone and scared or sad, please reach out for help. There are many people in community organizations available that are ready to help, and they are just a 211 phone call away. This pandemic is having a serious impact on the mental health and wellness of our community. There are many members of our community who struggle with alcohol abuse and other substance use disorders. For more than 70 years, the Council on Alcoholism and Drug Abuse, CADA, has been serving families in our community. As more and more community members are struggling with the stress of COVID-19, CADA is here to help. CADA's Daniel Bryant Youth and Family Centers in Santa Maria and Santa Barbara continue to provide treatment and support for young people with substance abuse disorders and their families. Friday Night Live, CADA's youth leadership program, is convening youth virtually to build community and provide peer support during this difficult time. Project Recovery, a counseling service for community members who have substance abuse disorders and those who also have a co-occurring mental health disorder, continues to provide individual treatment and group therapy through telehealth. These are just a few examples of the resources that are available in our community. To learn more about CADA, or how they may be able to help you or a loved one, please visit cadsb.org, cadsb.org, or call 805-963-1111. 1433. Also, please remember that the community's wellness team is also available to connect you with a variety of local mental wellness services. To speak with a member of the community wellness team, please visit sbccwt.org, sbccwt.org, or call 805-364-2750. Please don't be afraid to ask for help. Our community is here for you. Next, I'd like to introduce Dr. Henning Enzorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. Unfortunately, we reported another death on Saturday from COVID-19, bringing the total to 7 in the county. The community member was in their 70s with underlying health conditions and was a resident of the unincorporated area of the Goleta Valley and Gaviota. We extend our condolences to this community member's family and loved ones. Additionally, I'd like to clarify that the 6th death announced last week was a resident of the Lompoc area and was not hospitalized at Lompoc Valley Medical Center at the time of their death. Today, we are reporting 2 new cases of COVID-19 in Santa Barbara County. We now have a total of 473 cases. Of these, 99 are recovering at home, 38 are hospitalized, with 11 of them in the intensive care unit. We are very pleased to share that 322 people have fully recovered. 7 people have unfortunately died. We will from now on be reporting COVID-19 related deaths by the city or area in which the person resided. This information can be found on our website at publichealthsbc.org following this press conference. Our COVID-19 related hospitalization and ICU admission rate has remained stable over the weekend, which again is directly attributed to our efforts as a county with maintaining physical distancing. The Public Health Department, joined by local medical experts and business leaders, have met today for a meeting on planning on how to best transition into the next phase of easing out of the stay-at-home order locally. As you know, only the governor has the authority to ease the statewide measures in California. The decision on when this will be possible has to be made thoughtfully, safely, and rationally, founded in scientific data. Locally, we want to make sure that we have a plan in place and are ready once the qualifying criteria for reopening have been met. Earlier today, our hospitals and surgery centers were able to slowly restart previously scheduled surgeries and postpone preventive care procedures. Again, this has been made possible by our communal achievements through successful physical distancing. Almost daily, new information on the devastating effects of COVID-19 are coming out in the scientific literature. We understand more and more about this virus with each passing day. One big concern is that COVID-19 does affect even young and previously healthy individuals actually more frequently than we previously thought, with sometimes devastating outcomes. I urge everyone to remain vigilant with minimizing their activities outside of the house and to continue with our efforts in blocking the spread of this virus. Thank you.
Thank you, Dr. Enzorg. Now we'll hear from Captain Matt Ferris, the Division Chief for the Santa Barbara County Fire Department, who has an update from the Unified Command.
Thank you, Supervisor Hart. Yeah, I'm Matt Ferris. On April 7th, the county engaged the fire department's local incident management team to help manage the incident. It does more than just manage, but it helps with the process and to ensure that all of the county's needs are being met and all the public's needs are being met, including re-engaging into when we are able to go back to work and be with our families. The team is made up of all the fire agencies and law agencies within the county jurisdiction. Our incident commanders are made up of fire, law, the CEO's office, and Public Health Office. We treat this as public health is the fire, and it's their incident. We're here to assist them to make sure that everything runs smoothly. We were able to establish a process that works within the county, and all the county families work together instead of in silos. That's been a problem in the past. It's a lesson that we learned from the debris flow, to make sure that everybody works together and everything comes together, and reimbursement from the county, from the state and federal levels comes to us appropriately. We've been working with all the community leaders and working within the state and federal guidelines. And why is this important? Because we have to make sure we follow the state and federal processes as well as our own. We are here to assure that everyone gets back to work safely and everybody has a job to go back to, and that we're here to assist you if you don't. One thing that we learned talking about is from one of our other ICs, Woody Enos, works for the fire department. His analogy was, after 9/11, we were all afraid to fly. But TSA was created, and now it's okay for us to wait in a 2-hour line. Things are different now. We go into a grocery store, they wipe down everything for us. We have to wear a mask. We have to stand 6 feet apart. And that's okay. It's become the new normal. And that's part of what we're here to do, is to help you understand what the new normal is so we can get on with our lives, we all go back to work, and not get everybody sick so we don't peak again at a later time. And I would like to thank the other board members for engaging our incident management team. It means a lot to us. We are here for the community and the county. Thank you very much.
Thank you, Captain Harrison. Thank you for the message about being adaptable at this point in time. I also invited back Judith Smith-Meyer from the Food Bank of Santa Barbara County to talk about an exciting new initiative that the Food Bank has created. The Food Bank is connecting local seniors in need with healthy restaurant-prepared food. The unique beauty of this new collaboration is it gives seniors who need healthy meals hot food prepared by local chefs from local restaurants that would otherwise be out of work because their restaurants are closed. Judith, thank you for being here, and thank you for telling us about this incredible new service.
Thank you, Supervisor Hart. Hi, everybody. I'm very happy to be here to share with you what the Food Bank is up to try to take care of the community as this process continues. As the community faces ongoing job losses resulting from COVID-19 safety measures and spread of the virus, more and more people in our county are facing food insecurity. Savings are drying up, and the numbers of households who can't make ends meet is continuing to grow. So here's our reminder: the Food Bank of Santa Barbara County is ready to serve the entire community, and we're here for everyone. If you need any help or would like to learn more about where to find food, visit foodbanksbc.org or call 211 to find the nearest food near you, or to sign up for senior home delivery. Safety is still our main priority. We have 50 locations where you can receive food safely countywide. 20 of those are no-contact drive-throughs. Senior home deliveries are available for any senior, 60 or over, or 55 and over if you have a disability. We've recently added to the stringent use of PPE, physical distancing, and safe food handling guidelines, health screenings for all staff and volunteers. Safe handling food recommendations are attached to the outside of any food containers we provide to you, and then another list of other safety measures to take once the food is inside your house is listed inside the box. All of this information is also available at our website. And last Saturday, I was at a food distribution at the United Boys and Girls Club on the west side of Santa Barbara and saw inside the box bilingual flyers about CALM services that CALM has available to the community. We'll be distributing census information, so there's other information inside those bags and boxes of food as well to keep everybody going and as safe and healthy as possible. So our 211 call center has received up 2,300 calls by now. In the last 6 weeks, we have distributed more than 2.3 million pounds of food. As of last Friday, that still represents a 100% increase year over year from 2019. That's an average of 80,000 pounds of food per day. We're thrilled that we're still able to provide 50% produce. of that amount. That's thanks to produce growers and distributors, local and otherwise, individual donations and wholesale purchases. Just to give you some examples, last week at distributions, community members received avocados, citrus, lettuce, cabbage, pineapples, cantaloupes, fresh berries, bananas, tomatoes, potatoes, carrots, onions, and more. So we're really trying to keep everybody healthy with good nutrient-dense foods. And we're continuing to source enough food to meet current needs. So that's, I want to reassure everyone that if you are having need, you're not going to be risking anybody else not getting food if you come out to receive food from the food bank. About our home deliveries, we have made 7,600 home deliveries to seniors countywide to date. 4,500 of those have been in North County, 3,000 in South County. How do we do this? I want to share a good news story. We have longstanding partners who have been operating our brown bag programs for low-income seniors countywide, and these sites are now serving as hubs for our home delivery program. Last week at one site, 500 home deliveries were launched in 2 hours with the support of partners who include, this is a partial list, PathPoint staff and vans, community partners in caring, Family Services Agency, Clark Pest Control, Santa Maria Fire Department, and the City of Santa Maria. That's where this distribution was located. Vandenberg Air Force Base. There was a bike delivery team from BC Centro Bicycle Club who took off in a series of bikes to do deliveries. Our beloved National Guards were delivering food in vans on loan from Girls Inc. And then there was a host of volunteer individual drivers who were helping. Behind that, our staff members were scrambling to coordinate dozens of volunteers. They were providing food in bags and boxes prepared by volunteers at our temporary supplemental warehouses. This was food sourced by our operations staff via food chain relationships from growers to retailers, through our grocery rescue program, the USDA and federal government emergency food programs, and increasingly through wholesale purchases. The food bank has spent $250,000 so far in our COVID response on food purchases. So I just wanted to share that as a little example of the breadth of what this effort takes, and we're so grateful to all of our partners, volunteers, and the community for helping. It could not be done unless we all worked together. As I mentioned, we have about 400 new volunteers who have signed up since our COVID response took place, and we still need more to help us pre-pack bags at warehouses, work at our 50 safe food distribution sites, and to do home deliveries. So to volunteer again, visit foodbanksbc.org. We welcome your help. And finally, thank you for introducing this, Supervisor Hart. I want to talk about our Chef's Kitchen program. Last week on Thursday, we announced and piloted our Chef's Kitchen program, which was developed by food bank board members and food bank leadership to provide seniors with healthy meals prepared by local chefs. This is a way, as Supervisor Hart mentioned, to provide food to those who need it and contribute to economic health of local restaurants and their employees at the same time. For the program pilot, Acme Hospitality team provided 1,000 meals prepared by chefs Jason Paluska of the Lark and Nick Ramirez of Loquita and their teams. This week, 1,000 more meals will be shared with seniors through Pilgrim Terrace, La Casa de la Raza, and the County Department of Behavioral Wellness. We're also in talks with Meals on Wheels and the Community Action Commission to find other avenues to distribute the meals. Also, Food Bank is really proud to be part of an evolving community-wide team working to support local businesses while providing healthful food for all of those facing hunger at this time. Chef's Kitchen is operating in tandem with programs like the Community Food Collaborative via Community Environmental Council and SB ACT, which will soon pilot a program to provide meals, also from the Acme Group, for their pilot, to unsheltered residents in the city of Santa Barbara, with plans for more to come. We're all ready to be agile and pivot and figure out the best ways that we can work together to make sure that everyone in the community has the food that they need. So as always, call 211 to learn more. And then finally, on Friday, Governor Newsom announced a statewide program to match seniors under stay-at-home orders with local restaurant meals. So as always, the food bank is ready to be an agile facilitator of the goals we all share. So possibilities about how we might pivot to make this program work with things that are already in place include finding ways we can offer our robust infrastructure for home deliveries to be of best service throughout the community. That might include switching Chef's Kitchen focus to provide meals to immune-compromised individuals and families who are under mandatory quarantine, so broadening the area that we might serve outside of seniors if the governor's program covers everyone who would have need in that category. And another possibility is to work with county administration in partnership with the Area Agency on Aging and other partners to implement whatever level of statewide program may be put into place here in Santa Barbara County. Needs are still being assessed, so the food bank is participating in that process as we all figure out together what to do that's best. Finally, in the works, the food bank is launching next week a text program at which community members can text their zip code and will get texted back the 3 nearest safe food distributions to them. This will be available in Spanish and English, and we're pleased that we're able to offer access to information about where food is available to members of the community who may not have smartphones, unlimited data, or access to good Wi-Fi. Finally, we're currently raising funds to meet a $100,000 matching gift that's in place thanks to a generous anonymous donor and the Sangham Foundation. That means all donations coming in from now until the match is met will be doubled. So finally, to find food, to donate, or to volunteer, please visit foodbanksbc.org. And if you need help, again, the food bank information is available at 211. Thank you.
Thank you, Judith, and thank you to the whole food bank team for all the creative, exciting work that you're doing to protect folks in our community who are food insecure. Now we'll go to questions from the room. Ms. Lair?
Dr. Ansor, could you talk about how there's new studies coming out? If you have people, first responders in the medical field that are returned to work after full recovery, what the concerns are about them possibly getting COVID-19 again?
I haven't read those studies. If you please could send them to me so I can review them. We do not know at this point if COVID-19 can be had again. It's probably too early for that because the first cases occurred in January in China and then early February in the United States. So we will have to wait and see how that will affect us. But it is a possibility and it is a concern, but that's all I can say to this at this point.
How many medical workers are back to work after recovering, though? You have that?
The only data I have is that we have currently, we have had 59 cases of healthcare workers that have been sick with COVID. The vast majority of those have come back to work, but I don't have the exact number.
And finally, could you paint a picture, Dr. Answerg, of how someone could get COVID-19 on the beach?
Well, I would not be concerned about the ocean water itself, except, there is a caveat, except after heavy rainfalls. But as always, at least 3 days after a heavy rainfall, please stay out of the water. Otherwise, if our water quality gives a warning, please follow these warnings. But COVID-19 is found, or let me rephrase, traces of COVID-19 virus RNA is found in sewage. So therefore, because some sewage ends up in the ocean, we will find some remnant or leftover genetic material from the virus. This does not mean that those particles are actually a virus that can make you sick. So the ocean water, for all intents and purposes, is not causing COVID-19. At the beach, however, it's possible to be too close to each other and therefore get exposed to droplets. And that's why we really encourage, not just encourage, but the Sheriff's Department and all the helpers are educating and, if necessary, even enforcing that people keep distance. Otherwise, we would have to close the beaches.
Thank you.
Mr. Dreyfus?
Yes. With the warm weather coming up, are we concerned about any fires breaking out? And if so, is there a plan to address if it gets out of hand as well?
Yes, there is. We've been meeting regularly with our own team and how we would split up and deal with the COVID virus and the fire at the same time, which we've restricted a lot of our people from going out on other team assignments throughout the state to stay here to concentrate onto those. Also, the state has developed what they call an area command team that has already put together a report on how we would deal with large-scale fires with the COVID virus. You're going to see us fighting fires a lot differently in the means that we'll be social distancing, how we eat. We'll not have congregate eating together anymore. It'll be handed out just like we do now in a box, a clamshell, and everybody might be eating out on the line more. You're going to see it a little bit differently, but yes, we are totally prepared for that, and our resources are in place to deal with that as we approach the warming months.
Great, thank you. And my other question is that we haven't really touched on what people should be eating. And a doctor out of Brooklyn actually was on a show the other day talking about how to eat healthy. Dr. Ansorg, do you have any suggestions, or have you put up any guidelines about how we should be eating more fruits and vegetables and eating healthier to help fight this and combat this?
Yes, thank you for that question. I think it is very important because nutrition has a direct effect on our immune system. Depending on how the quality of our food is and the amount, and also if we eat too much sugar or sweets, that has a direct effect on our immune system. So I recommend strongly to eat lots of fruit and vegetables and moderate amounts, not to overeat, because otherwise the immune system gets strained. And like with every virus, you want a very strong immune system. Also make sure to stay well hydrated with fresh water, and it's very good advice to prevent you from catching virus disease.
And that's why the food bank has such wonderful, healthy, nutritious meals for their population that we're trying to feed.
If I may share something,
Sure.
Supervisor Hart. In addition, the food bank has on its website posted a guide to recommended foods that was developed by Lacey Baldivias, who is a nutritional biologist and a staff member at the food bank, our director of community education and programs, with creative ideas and other thoughts that are ways that you can use foods that will last a long time for maximum health, and how you can balance fresh foods and other staples that would be part of your pantry, and also things that are offered by the food bank. So that's available to everybody, a guide to recommended foods on the website at the food bank. Thank you.
Thank you. Next, we'll go to questions on the phone.
Yes, we have time for a couple questions. Malia Martin with Santa Maria Sun, go ahead.
Hi, this is for Dr. Ansorg. It's my understanding that Marion Hospital now has some antibody testing capabilities which could help gauge community spread. So I'm wondering how might this kind of testing help the county to continue to address the pandemic?
Thank you for your question. You're exactly right. Marion is able to run antibody testing in their own lab, which is excellent. We do utilize send out labs as well. Quest is up and running, and LabCorp through PDL will be as of tomorrow, I'm told. So the antibody test is a blood test, and it is not a diagnostic test for the virus illness. If we want to find out if somebody actually right now has the illness, we still have to do this nasal swab and test for the virus RNA itself. Now, the antibody test will become positive once somebody has recovered from infection, and that takes weeks, anywhere between 2 to 4 weeks for those antibodies to show in the blood test. It will be very interesting in the near future to see how many people had contact with this virus, and it will give us very valid information about how far it has spread through the community. However, it is not a diagnostic test, so it is more a surveillance test to find out how many people did get in contact with this virus unknowingly.
Thank you.
Next question.
Next up is Reza with San Ynez Valley Star. Go ahead.
Hi, everybody. Happy Monday. I am wondering, this might be directed more for Judith, but I have a restaurant, a few of them actually, who have wanted to know if they could be part of the cooking for seniors or the people that have the virus right now, and how would they go about doing that?
That's a great question. Thank you, because all of us who are involved in this process are looking to expand these programs. Right now, the food bank has temporarily hired several staff members, but one of them is Iris Kelly, who is actually on staff at Community Environmental Council, and she's going to be working for 3 months with us to manage the logistics of this program. So she can be reached at IKELLY at foodbanksbc.org. You can email Iris and she can fill you in on how it's going to all work, which is something that's evolving and we're still figuring out. So this is a very fluid program at this point. We're figuring out how to best meet everybody's needs and how to do it best from both ends, those we serve and the restaurants and chefs who might be involved. So contact Iris. Thanks.
Another question for you, Judith, is that a lot of the local farmers some of them are having to till their produce under or, get rid of their products. So how can we best utilize those that actually would be, wasted? We don't want to waste any food right now. And I know that there's a lot of insecure people, but our farmers are also saying that they're kind of in an insecure position as well.
Totally understood. And the food bank always works in an ongoing way with local growers. We have lots of strong and deep relationships with local growers and distributors. I would encourage any farmer who is about to till over some fresh, healthy food that's still usable to contact the food bank right away. We have an extensive food waste reduction program. We work with farmers and groceries and all kinds of retailers to rescue groceries so that things don't go to waste. We're committed as an active part of the food supply chain and the food system in Santa Barbara County and want to help in any way that we can. That food absolutely would be best used by those who are out of a job and having to feed their family right now. So definitely contact us, and we have a lot of that going on already. So that's how we're able to provide as much produce as we have been. It's a huge part of it. Thank you for asking that question.
Thank you so much. That's all my questions.
Thank you, Reza. And our last one is Nick Masuda with Santa Barbara News Press.
Yeah, hi there. Just a couple really quick questions. County officials that are firefighters, lifeguards, sheriff's office, are they required to wear masks or gloves when dealing with the public? I'm sorry.
Yes, they should be wearing any call that they go on. They should be wearing their full protective PPE so that when they encounter anyone, they do not know whether they have the virus or not, that they're protecting themselves.
And just a quick follow-up to that, in looking back at last weekend, is that something you guys might be revisiting with those same people to really make sure that happens this coming weekend?
Yes, we will. We'll ensure that our preference is that they do wear face coverings during those encounters. They're not responding to an emergency at that time, but they would be wearing face coverings and gloves.
Great, thank you. And Dr. Ansor, one quick question for you. With folks seemingly traveling up from Los Angeles County, which obviously is hit much worse than we are, is there any underlying fear that some of that COVID could be making its way to our coast?
Well, that is a very valid point. No county in the state is recommending any kind of travel. So people coming up the coast or, going places unnecessarily is very much discouraged, because the more people move, the more the virus can potentially be spread. So we have to appeal to the common sense and the insight of everybody in our neighboring areas as well, to please stay as close to home as possible and avoid unnecessary travel for exactly that reason. Thank you.
Thank you.
That concludes our calls and questions. Our next press conference will be held Wednesday at 4:30 p.m. Please remember to practice these 3 simple steps to avoid spreading the coronavirus. Please stay home as much as possible. When you have to go out, wear a face covering and stay at least 6 feet away from other people. Wash your hands, don't touch your face, and disinfect surfaces. And if you feel sick, isolate yourself at home. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Thank you for joining us today.